Well, as Nigeria joins the list of African countries that have launched their End Malaria Councils, President Muhammadu Buhari has described it as a bold step to eliminate the disease and save the country about 687 billion naira in 2022 and 2 trillion naira by 2030. Well, State House correspondent Adeswa here has more.
Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. According to the World Health Organization, 27% of all cases of malaria and 32% of deaths globally occur in Nigeria annually. The country holds an unenviable position of the world's greatest malaria burden. Eradicating the disease, mostly affecting children under 5 and pregnant women, has remained daunting for the country.
In spite of the steady progress to date, we are yet to meet the coverage and impact targets we set out to achieve for malaria elimination. One of the main challenges to attainment of these targets is insufficient funding for interventions at national and subnational levels.
Year in, year out, Nigeria will be needing about 420 billion. But what does this translate to per capita? It actually means we need just 2,100 to save a life in Nigeria every year. That's about $5. $5. And that's what we're seated in.
To help oversee the country's journey towards malaria elimination and ensure that sufficient resources are available to achieve it, President Muhammadu Buhari inaugurates Nigeria End Malaria Council, a high-level council of individuals from the private and public sectors. He projects that the successful implementation of the council's agenda and savings from the estimated economic burden of the disease would save Nigeria 2 trillion naira by 2030.
The End Malaria Council will provide a platform to advocate for more funding to protect and sustain progress made so far by our country and put us on a pathway to ending malaria for good. The successful implementation of the Council agenda will result in improvement in the quality of life, health, and well-being of Nigerians by providing impetus for malaria elimination and by saving about 687 billion naira nationally, which is the estimated economic burden of malaria for 2022. The savings could increase to 2 trillion naira in 2030.
President Buhari also reveals his choice of Dangote, Africa's richest man, as the chair of the 16-member council.
I believe he will also bring his outstanding achievements to bear in this cause to help our country achieve its goal of malaria elimination.
Accepting the responsibility, Aliko Dangote promises to galvanize the private sector commitment to deliver on the mandate.
Together, we will work hard to ensure that malaria elimination remains high on Nigeria's agenda with strong political commitment from leaders at all levels. We will advocate at the national and state levels to ensure sufficient funding for malaria elimination.
African leaders aim to eliminate malaria from the continent by 2030. The success or otherwise of Nigeria's strategy to completely eradicate malaria, experts say, will depend largely on efforts to curtail the breeding of the vector, to include improved personal and environmental hygiene by all.
That's it right there. Well, so the question is, how feasible is this move to eradicate malaria in 8 years? Well, we're joined now by a public health expert, Dr. Tuyi Mebawondu. Thank you so much for joining us on Newsnight tonight. A very simple question to ask you. I mean, how feasible is this End Malaria Council? It will not be the first attempt at pushing back malaria. What are your expectations from this council?
Well, thank you so much. This is not the first attempt, like you really pointed out, to end malaria. If you remember, as far back as 1948, we had what we call malaria control services, and then which later metamorphosed into malaria eradication or control program as it is. And then we've had about 4 strategic malaria control programs since then, and the latest one is this 2014 to 2020. And of course, we're trying to eliminate malaria, reduce it to pre-elimination level, and then be able to cut down the death arising from malaria attack. It's a huge ambition. Oh, you know why it's a huge ambition? Whenever malaria spreads, it brings misery, it brings poverty, it brings underdevelopment, apart from death. And Nigeria is a huge elephant in the whole world. 27% of all cases of malaria resides in Nigeria. 32% of the death from malaria resides in Nigeria. Every year, we have as much as 52 million bites. That's 1 out of every 4 Nigerians with malaria, and we lose about more than 80,000 deaths. That is every 9 hours. Every hour, 9 persons die of malaria. Most of them children under 5, most of them pregnant women. And even you talk about household, as much as 60% of outpatient visit to the hospital is for malaria, taking away as much as 20% of household out of pocket expenses. It's a really, really huge problem. Why it's a huge problem? The first thing that you need to deal with malaria, or what you call elimination of malaria, it means that there will be 0 transmission of malaria in the country. 0 transmission. We are not getting malaria from the vector to human. That is the goal we're setting in the next 7 years. It's quite huge. It's Herculean. Now, because the first thing you need, of course, is governance. You need not just clinical governance, you also need government to be part of it. We have gotten to that whereby government says that, listen, they're selecting the private sector initiative comprising of big industry people, you know, players in the economy to be part of the malaria elimination program. Brilliant, wonderful. They need to eliminate the malaria because it's going to affect the workforce. I mean, no doubt. But moving from that, you need money. A huge amount of money. Look at the loss we're going to get. The estimate is that, you see, 1 point... Yeah.
Great. That brings us to my next question because, you know...
As much as 1.1...
Doctor, finish your point so I can come in. Finish your point.
Yeah, as much as $1.1 billion is going to be lost annually from malaria, and we're looking at about 2 trillion in the next 7 years. Now, Nigeria is not just having malaria as a problem. We're having infectious diseases mutating, coming out. We're having challenges in every area, even non-communicable diseases. And most of our programs running in Nigeria that we can say kudos are driven by donors. How sustainable are donor-driven programs? The second thing is that you need technicalities, human resources, materials, monitoring, surveillance, huge thing. And when you look at Nigeria, you look at the human resources needed to drive these things, they're just non-existent. You know, you are aware of the challenges of the human resources for health in Nigeria. You are aware of the brain drain happening. You are aware of the ASU on strike who are not training more health practitioners, who are not training more people that's going to be involved in it. We cannot just wake up and say that, listen, yes, it's nice to set ambitious goals, but is it realistic? But having known that these health challenges is not just going to affect the health of the people, it's going to affect the company, it's going to affect business, it's going to affect GDP of Nigeria as it is. Choosing the likes of Aliko Dangote, choosing the likes of Numelu and Co. to head the program, you know, makes a lot of sense. We'll see what will happen.
Yes, Doctor, and you've made you've made the point, and I think it reverberated today that malaria is not just a disease; it's a socio-economic problem that we need to tackle as a country. But it looks like, you know, this is more money being thrown at a problem, like they say. It doesn't really solve it, and I think you've spoken to that about human resources. But tell us, for those who may not understand, how money will solve the malaria problem that we have in Nigeria as the world's biggest malaria-burdened nation. How does money solve the problem?
Now, let's understand the path to elimination, which is the target of this government. Elimination means that there's zero transmission of malaria within the country, and we're not having a new outbreak. And this must occur in 3 consecutive years. It's not a difficult thing. It shouldn't be a difficult thing, because you are seeing countries like Algeria, Seychelles, Mauritius, Lesotho eliminating malaria in Africa. So you wonder why Nigeria shouldn't be able to eliminate malaria if Lesotho can do that. First of all, it's the commitment and that will. And then you need to put behind that the human resources. If you look at those pillars, first of all, you need to actually be able to detect and treat malaria. That speaks to the challenges of getting drugs, of rapid diagnostic tests, surveillance, and all those things. That speaks to that. That requires a lot of money. And you know what it costs in terms of, with the dwindling naira, the cost for the country producing anti-malaria. We have to sustain that consistently. And we have to keep on surveillance to ensure that we don't get a resistant strain, which will now put a stress on our control measures. The second thing is that you need to control the vectors. What are these vectors? The mosquito and their breeding space. Malaria involves 2 animals, mosquito, humans, and a parasite, which is Plasmodium in between them. And in an environment that's a bit complex. So, you need to deal with that. We have gutters that are not flowing, climate change, environmental issues. It's not just about the drugs. It's not just about the doctors being appearing there. You have to control the vectors. And in addition, you need to target the vulnerable groups. 11% of maternal mortality from malaria, 20% of under 5 mortality from malaria. You need to really expose those and then reach the rural area to deal with the challenge of malaria in that regard. And then you have to keep on surveillance. Then epidemiologists are needed, and they have to be trained. You have to monitor. It's a critical thing, whereas you are still contending with all other things. So if you look at all these pillars, and we're trying to achieve zero malaria in the next 7 years, you ask yourself, how do we start? You look at our health budget, we're doing 5% at best, 5%. What will 5% do? Most of those 5% is actually a recurrent expenditure. We're not putting money into re-thing. But good enough, we have the malaria vaccine now being deployed and being used, and having as much as 70% effectiveness. That is a great score point for us. But now, where do we get money to buy those vaccines? Vaccines for monkeypox is there, vaccines for COVID is there, malaria vaccine is there, our expanded program on immunization is there. Honestly, it's a huge thing. But what we can do is try to strengthen the vector control, individual interference in such a way that we can be able to achieve reduction in malaria prevalence in Nigeria. Now, we need each state to be able to drive a goal to say that, listen, as a state now, I am going to ensure that I control my malaria prevalence. Which state has that ambitious goal in the whole 36 states plus 1 in Nigeria? Great.
Very good place to leave it. Good question there that the leaders at the subnational levels need to quickly chew on. Dr. Tuyi Mebawondu, thank you so much for joining us on Newsnight tonight.